Welcome to America's Heroes Group.
Welcome back to America's Heroes Group. This time the roundtable partner, Mazon. September is National Suicide Prevention and Hispanic Heritage Month. Saturday, September 9th is today, 2023. Our host is Kelley. I'm Sean Claiborne, the co-host. Our executive producer is Glenda Smith. Our digital media producer is Ortega of Scott's Arnold Productions. And we have our partner with us, Josh Protas. He is a vice president of public policy and heads the Washington DC Office of Mazon. Josh coordinates and implements Mazon's advocacy agenda to strengthen and improve the federal nutrition safety net. We're going to talk about the Jewish organization's response to hunger. How are you doing today?
I'm doing great. How about you?
Pretty good. So you have a lot of experience with working at the local and the national level with this issue of food insecurity, food access to food and healthy food. What is the mission of Mazon? Can you explain that in more detail and how this organization got to this mission?
Yeah, absolutely. So first of all, Mazon is a Hebrew word. It means nourishment or sustenance. We're a national organization that brings the American Jewish community voice to anti-hunger policy and advocacy. So we're really centered on the policy and advocacy because we know that the charitable sector does important work to meet emergency needs, but it just doesn't have the capacity to fully address an issue of the magnitude of hunger in the United States. And that's why government programs, and particularly federal government programs, are so critical. The Supplemental Nutrition Assistance Program, SNAP, formerly food stamps, is the most powerful anti-hunger line of defense that we have. And it's critically important that that program is robustly funded, works efficiently, and has the full capabilities to reach everybody in need. So Mazon's been around since 1985. One of the things we've done over the years is really look at populations that have unique needs and challenges that sometimes fall through the cracks, not only because of program access, but also the anti-hunger community may not focus in as much. And over the past decade plus, we've been leading national efforts to address food insecurity among active duty military families as well as veteran families, and really trying to close some gaps that exist. It's just shocking that we even have to talk about food insecurity for military families. Like, those should never go together in the same sentence, but too common they do.
Mm-hmm. And that leads me to the question that I'll ask later, because it's a loaded question, and then I know neither of us have the answer to it, but I wanted to get through these other talking points first. But I'm glad you touched on that question of why there is food insecurity among military family members and veterans in this country alone. But what are some of the policies that are being tossed around in D.C. that would improve hunger among veterans and military families?
Yeah, so the issues for currently serving military families are a little bit different than for the veteran population. So for currently serving military families, there's actually a barrier that makes it more difficult for them to qualify for SNAP, even when they need that help. So Mazon's been leading the effort to try and address that. The Supplemental Nutrition Assistance Program is authorized as part of the Farm Bill, which comes up before Congress about every 5 years, and we're currently in a Farm Bill cycle. So there is legislation, and one of the champions on the Senate side is Senator Tammy Duckworth. She's long been a champion on this issue. It would make a simple change to remove the barrier for military families. And the issue really stems from the way the basic allowance for housing, which is given to service members who live off base or in privatized military housing, the BAH is not counted as income for federal income tax purposes in most federal programs, but for SNAP, it is counted as income. And so when you take even a low rate of base pay for a junior enlisted service member, but you add on top of that their BAH, it often puts people outside of eligibility for SNAP, even though they really need that help. And the people we're talking about are junior enlisted service members who are trying to support a household. You know, they have multiple dependents, and they're often getting by just on a single source of income. So in the Farm Bill, we are pushing very hard to try and remove that barrier. At the same time, in the National Defense Authorization Act, there's a program that just got started that in a way was a workaround solution to this barrier to SNAP. It's the Military Family Basic Needs Allowance. And so that conveys to service members who are at or below 150% of the federal poverty level based on their household income. But for that program also, the BAH is treated as income, so we're trying to rectify that as well.
Hmm. And
then go ahead.
No, I was just going to add that people don't realize that when you're a junior enlisted, or if you're a certain E1 or a person who's just getting into the military, and you don't really have any real rank, you're just a new enlisted person. You don't make a lot of money, so the military's already kind of baked in the cake of your pay that you're going to be on base. Probably we're going to feed you. We're going to give you uniforms. You don't have to buy clothes all the time. So that's basically what you're living off. You're living off bare minimum. Possibly you can make more money if you actually did the math working at McDonald's than while you're actually an E1 or E2 even an E3. You could spend 2 or 3 years in the military, and you got a family to support on top of that, and you might be the only breadwinner in the family.
The compensation structure is really still more geared towards single individuals, and part of the challenge for military families is a very high rate of spousal unemployment. And when you think about it, that service members are PCSing and moving every 2 to 3 years, many employers are reluctant to hire a spouse if they know they're just going to be gone in a couple of years. And so the rates of military spouse unemployment are about 24-25%. That doesn't even take into account underemployment, where somebody might be taking a job that's below their training or reduced hours. So that's one of the complications for military families. And then related to that is the lack of accessible and affordable child care. So, that leads to higher rates of unemployment because a spouse may not decide to go and work if it hardly covers child care or if they can't even access that.
So what are you mentioned some of the contributing factors about what leads to food insecurity. What are some of the things that can be done, especially with the new legislation coming out, to try to impact this or try to fix this?
Yeah, getting the policy right is really important. So when Mazon started doing this work, we were just shocked to learn that this was so pervasive, and it's really been an issue that has been ignored for a long time. And the sad truth is that there are food pantries on or near every single military base in this country that are quietly serving families that can't get the help they need from programs like SNAP, and so they're turning really in desperation to the charitable sector. It's important to meet people where they are now and meet their emergency needs, but there's no reason that military families on a routine basis should have to go to food banks and food pantries. We really need to have the federal government take responsibility. We're asking so much of military families. The least we can do is make sure that they can put healthy food on the table. So getting the policies right by removing the barrier to SNAP and then also making sure that the basic needs allowance works properly would go a long way towards giving some extra purchasing power to military families. So making sure that there's strong congressional support for that. I know in Illinois, you're blessed to have great representatives and senators. As I mentioned, Tammy Duckworth has long been a champion on this issue. We just need to get some deeper bipartisan support to get this over the finish line.
And Tammy Duckworth, of course, is a U.S. Army veteran herself, Black Hawk helicopter pilot who was shot down and lost her legs in an accident when she was serving. Now, what are some of the policy, more specifically, what are some of the policy issues that Mazon wants to advocate for? Because that's what your core job is. You guys advocate to try to change social policy and legislation. What's some key things that you guys really want to see happen to really get a handle on this situation?
Yeah, so we're deeply engaged in the Farm Bill process right now. So the Farm Bill, as I mentioned, goes through Congress about every 5 years, and the current Farm Bill is set to expire September 30th of this year. Now, it's possible that it's probably going to get delayed before they reauthorize it. We're pushing really hard to protect and strengthen SNAP, just fundamentally. And there have been some in Congress who have been trying to chip away at SNAP. They actually pushed in as part of the debt ceiling agreement to extend work requirements in SNAP. So to add the age limit, so it goes up to age 54 now, where able-bodied adults without dependents have 3 months of access to SNAP, and then they lose it if they're not employed or in a registered job training program or some other things. We know those work requirements just don't work. They don't lead to higher employment or earnings for individuals. They just make it more difficult for somebody to get back on their feet if you take their food away from them. So ideally, we'd like to see work requirements go away. In this political environment, it's probably not realistic that that's going to happen, but we don't want to have more strenuous work requirements added to SNAP. So in some ways, we're playing defense. There are some things we want to do, like removing the barrier for military families. There's a policy in the Farm Bill we'd like to see that would change the calculations for disabled veterans. So currently, if you're a veteran who has a VA disability, you only are treated as disabled under the SNAP program if you have a 100% disability rating. There's proposed legislation to change that to 60%. So that would make it a little easier for disabled veterans to have some special considerations for SNAP. So that's among the things. We're also doing some focused work about the people of Puerto Rico and being able to have a transition back into the SNAP program for Puerto Rico. We're doing some focused work on Indian country, where tribal nations are interested in administering programs like SNAP. And interestingly, there are very significant veteran populations in Indian country and also in Puerto Rico. When you look at food insecurity in this country, disproportionately, it's people of color who are impacted, and that's just not right. So SNAP, is a program that helps to level the playing field. It gives people the support they need, but we need to make sure that we don't have barriers that make it more difficult for them to get that help.
You touched on an interesting fact, because when I was in basic training and AIT, my initial training and my advanced training when I became a mechanic, probably about, I'd say, a little bit less than 10% of our platoon was from Puerto Rico. Two of the guys I served with, 2 or 3 of the guys I served with didn't even speak English that well. They were learning English as they were serving. They spoke Spanish. Yes, and in the Native American population, it's known and well documented that a large percentage of Native Americans, I don't know if it's a warrior culture or something that goes back to the old days, but they have a large percentage of their population and their culture who joined the military and served in the military. And a lot of medals of honor have been handed out to Native Americans.
Native Americans serve in the military at the highest rate of any demographic group in the country. And also, if you look at tribal reservations, the rates of food insecurity are by far the highest there. So there's definitely some inequities. And in Puerto Rico, let me just mention quickly, I didn't really understand this before I started working on this issue, but Puerto Rico is an American territory. People who live there are U.S. citizens. But there are lots of policies of territorial exceptionalism that treat U.S. territories really as second-class places. And, for example, people living in Puerto Rico are U.S. citizens, but they are not eligible for programs like SNAP. Puerto Rico was explicitly taken out of the SNAP program, and instead there's a block-granted program that has limited funding. It's called the Nutrition Assistance Program, or NAP. But that program does not fully respond to the needs in Puerto Rico, and it doesn't have the ability to increase when there are times of natural disaster like hurricanes. And we're in the midst of hurricane season now, and Puerto Rico is still recovering from the last wave of natural disasters. And so we treat places like Puerto Rico differently, and it makes it more difficult for people to just get ahead.
And going back to what you touched on earlier too as well, because I wanted to get into this, and so I know a lot of people are concerned about this, and this is an argument against some of the points that you've talked about. The data from which you've mentioned shows that when you make it harder for people to qualify for food and get food help to buy food and things like that, especially nutritional food, it doesn't help people get off poverty, get out of poverty, or get jobs or do anything. Like, so when you
Right.
make work requirements and things like that, you're saying that the data shows that it's ineffective at trying to get people to, buy their own food by cutting them off from getting food. So
Yeah.
can you speak more to that, and why is that such a pervasive theory, and is it just based in what people's ideologies are, or is there any other data that shows that, well, if you make it harder for people to get on welfare or harder for people to get food stamps, they'll figure out something else to do, and they'll go take that job working at UPS or take that job doing something else so they can make money?
Yeah. You mentioned ideology, and this is really about ideology. I mean, the overwhelming number of people who are able to work, who receive SNAP, do work. And SNAP actually supports a very large number of working poor in this country. I think that there is this mythology that welfare programs keep people out of work, and a lot of this is based on stereotypes that are often racially coded, and it goes back to the 1980s and the stereotype of the welfare queen, and that people have this idea that government benefits are leading people to lead comfortable lives and just sit on the couch all day and not work. The reality is most people who are able to work, the overwhelming majority of people who are able to work, want to work, and either they can't find work or they face barriers like transportation that make it difficult. Programs like SNAP just help to give them a cushion to be able to meet their basic needs. And really, that should be part of our core social contract in this country, that people don't struggle to meet their basic necessities. And when you look at SNAP, I mean, nobody's leading cush lives because they're receiving SNAP benefits. The average benefit amount for SNAP is $2.03 per person per meal. I mean, most people spend more for their daily cup of coffee than that. So you're not going out and buying steak and lobster when you're getting SNAP benefits. It's a supplement. It helps hopefully to be able to enable people to purchase healthy food. But the sad truth is it's much cheaper to buy unhealthy food, highly processed food that just fills you up with empty calories. It's much more expensive to buy fresh fruits and vegetables and protein. But the benefit amounts for SNAP and other programs are just so modest that it's difficult for people to eat healthier. And then, unfortunately, it costs our country a lot more because when people don't eat healthy, they're more at risk of diet-related health conditions like obesity, diabetes, heart disease. They cost so much more in terms of addressing those healthcare problems down the road.
I haven't seen any real numbers or hard statistics on this anecdote, but many people say, and people advocates for food security say, that when the benefits go down, the crime goes up. Have you seen anything like that? So when people have a hard time getting food benefits or getting money for or getting things for food, how does it affect crime rates?
I don't know. I haven't seen anything specific around crime rates, but I mean, we do have some current examples where benefits have gone down. So we during the course of the pandemic, there was a boost to SNAP benefits, an emergency allotment that increased at a minimum $95 per month per person of a boost. That benefit boost expired with the end of the public health emergency. And then also during that time, we had the expansion of the child tax credit. Between those two things, it kept millions and millions of people out of poverty. It made a huge difference, particularly for children. I think it was a significant number of children who were kept out of poverty. And then Congress let that boost lapse. So I haven't seen a correlation with increasing crime rates because of the termination of those boosts. But I think, if you think at a personal level, people will feel more desperate if they're struggling more. And there aren't necessarily jobs that they can just go into. And they were probably looking for jobs before. So it just increases hardship, and how people respond to that hardship is going to vary. I'd be a little careful about the crime rate correlation because that might tie into, some of the stereotypes that get bandied about when you're talking about SNAP recipients. But what I would say is that, we know that increasing the benefit amounts, making sure that the programs like SNAP reach everybody who need the help, it works. Like we saw that during the course of the pandemic, that those benefit boosts decreased significantly the rates of poverty. And when we're talking about hunger, it's not a matter of having sufficient food. It's not a matter of having sufficient resources in this country. It's really about having the political will. If our elected leaders muster the political will to say this is a priority, we want to make sure that every person in this country can put food on the table, they can eat and not go hungry, we could do that. But as a country, we just have not prioritized that to the degree to really strengthen programs like SNAP and WIC and senior feeding programs so that they more adequately take care of the issue.
Mm-hmm. Do you see any improvement in the programs that can make them more efficient or make them more effective beyond just extending benefits? But what if you just took the existing programs and tried to make them more efficient? Would that help, or how would you? What are your thoughts on that?
Yeah, I mean, we've seen with SNAP in particular some innovations that have really helped the program to work better. So, first of all, when the program was known as food stamps, it literally involved stamps that you would redeem at a store, and there was a lot of stigma associated with that. People were embarrassed to pull out their food stamps and have other people in line see that they were doing that. And so the program has been changed, and SNAP is now uses an electronic benefit transfer card, basically like a credit card. And so that dramatically reduces the stigma. Over the course of the pandemic, we saw some rapid changes to respond to the emergency that really helped significantly. So rapid scaling up of online grocery purchases. So that's great. And you think about people who are homebound and may not be able to get to the grocery store. And so if they can do online purchasing and have those groceries delivered using their SNAP card, that's fantastic. We saw some relaxing of there's kind of a ban on purchasing prepared foods. And so in some cases where you can purchase like a rotisserie chicken at a grocery store, normally that's not allowed under SNAP, but there have been some flexibilities, and we see that makes a difference so that people can kind of meet their needs and be a little more flexible with the reality of their situation. For some people who don't have kitchen access, prepared foods are really important, and we see that for college students, and a lot of college students struggle with food insecurity, and so making sure that they have better access to supports that they need.
I've seen a few in my day when I was in college. Now, but why was that a case? Why was it such a bad thing for people to buy prepared foods with a SNAP card? I mean, I don't see why. What's the problem if you just go to McDonald's even with a SNAP card? Why was that an issue to begin with?
I think it was so SNAP originally was sort of predicated on the idea that you would prepare your meals at home. And so the benefit amount was actually originally calculated based on kind of home cooking. And it was based on the value of things like dry beans and things that take time to cook. So I think in some ways it's sort of an antiquated idea about how people eat. But it was also to try and keep people, like, not wanting people to just use SNAP dollars at restaurants, right? So the prepared food ban, it has some drawbacks to it. I think the idea is also to help people be eating healthier. But there's more and more of a movement to relax that ban on prepared foods, recognizing that like rotisserie chicken is a huge help for a family that is feeding kids, and you have two working parents or a single parent that's working, and you just don't have the time to prepare a meal from scratch. Rotisserie chicken is a great way to get protein on the table that doesn't take a lot of time or effort. So I think we're getting better at recognizing the realities of modern life, but there's more that we can do still.
No, now we have about 2 minutes left, and I wanted to get into this because this is a real thing. I mean, I've worked with veterans and people who are not veterans who are homeless on the street. Can a person who's homeless, who could never go and just cook anything or prepare a pot of beans on the street? I mean,
right.
How hard is it for someone who is homeless without an address to get on SNAP or get some of these programs?
Yeah, so we didn't get a chance to talk too much about veterans, but for homeless veterans, you don't need to have a permanent address. There are ways that you can apply for SNAP and have an address that you could relate to, that where your benefits could convey to you. So one of the big challenges for the veteran population is an under-participation in SNAP, where a lot of veterans are eligible and they leave those benefits on the table. You know, as you said, if you don't have access to a kitchen, it's trickier. Like, what foods would you be able to purchase using your SNAP dollars that you could eat? And there's some supports and resources to help with that. But we need to do a lot more, because of all veterans who are eligible for SNAP, only about 1/3 participate. So that means 2/3 of veterans are struggling needlessly. They are leaving those benefits on the table when they could really get that help from SNAP. And a big reason for that is a lot of stigma and shame and pride. Veterans either don't know about SNAP or they're reluctant to ask for that help. And we need to change that mindset.
Get the help you need, veterans. Do what you got to do to survive and also be healthier to get yourself out of the situation that you're in if you're in a bad situation. Always be looking to improve. Thank you for your time. I really appreciate you, Josh, for coming out and telling us about the things you're doing. And I'd like to have you back to get more specific things on the VA and what the VA is doing in the Department of Defense and Congress. Thanks for your participation in this conversation.
Thank you.
This is America's Heroes Group. We'll be right back.